5 mistakes some vets make, and here's why you should be questioning your vet. Hello, welcome back to my channel. If you're new, welcome. Click up there to subscribe, hit the bell to sign up for notifications. Then when you click that link directly in the box below, I can send you a copy of my free book. Believe it or not, veterinarians, some of them make mistakes. But there are a bunch of very common ones that I hear from subscribers and viewers, much like yourself. These are ones you should be aware of, and here's how to avoid them. Number 1, and this is the one I hear most often, lack of communication. Your dog or cat is sick. You go see the veterinarian. But what you say and what your vet hears, really different things. I had someone relay the experience where their cat was sick, who had been diagnosed with a chronic disease. The veterinarian communicated the diagnosis of CKD, chronic kidney disease, but after that, he didn't explain any other options. Yes, unfortunately for most cats, it is a terminal disease. There isn't some magic pill we can give to reverse kidney failure, but there are things that we can do to slow and delay the progression. Some clients want that. You want to be able to help your pet at home, especially if you can keep them comfortable, that they're eating and drinking, even if it is a terminal disease. This vet didn't ask about any of that. I made the suggestion to ask about sub-Q fluids, ask about an antacid. This kitty cat has really responded. So you need to be clearly advocating for your dog or cat, and you need to be asking them a whole bunch of questions. They might go down one tangent, make some assumption, the cat's just gonna die, these guys look kind of practical, there's no point doing anything to extend his life. Well, maybe that's not the case at all. That's not how you feel, that's not what you're wanting for your dog or your cat. So you need to communicate that. And or find a veterinarian that is a better communicator. Number 2, overuse of veterinary medications, antibiotics, steroids, flea and tick meds. Part of the big things you learn early on in veterinary practice is that clients come to you with sick dogs or cats and you want to be able to send them home with something to help their pet. It's hard not to see a sneezing cat and just not send them home with some antibiotics. Dog who's starting to itch a little bit, steroids, they work so well, you got to take these home. But the overuse of antibiotics, it's leading to antibiotic resistance. We're developing bacteria that are resistant to all these antibiotics, and then we're having dogs and cats seriously sick and we're unable to treat them. Or the corticosteroids. Yeah, they're great for instantly stopping your dog or your cat from itching, but they're secondarily suppressing the immune system. It can lead to other secondary complications such as diabetes. Not every sick dog or cat that comes into the practice needs to go home with some sort of conventional drug. In some cases, some of these guys are going to get better on their own. It's okay to wait and watch many times, but honestly, not all vets are willing to do that. Another point here, more diagnostic tests, more drugs. We're looking at elevated veterinary fees. But not all vets are going to overuse antibiotics, overuse steroids, and those are the ones that you need to seek out and find. Number 3, the emotional well-being of your pets. In vet school, you're taught about how to diagnose and treat sick dog or cats. We're taught about physical health. We definitely weren't taught about emotional health. We now know that the brain, mental health, it can have a direct impact and be the cause of many of the diseases. Think about a dog that has a lick granuloma. He or she is excessively licking the front of his leg. Typically, we're dealing with a dog that doesn't have enough mental stimulation. He or she is bored, not getting enough exercise, and that's leading to clinical disease. Or these cats that have feline lower urinary tract disease. We know that is directly correlated with stress. We're seeing these indoor cats, they don't have the stimulation they used to have going outside, hunting, etc. And what's happening? It's showing up as bladder inflammation. So it's not just treating those physical signs you're seeing, like Tula has a lick granuloma, let's just put on a topical steroid. It's also addressing the underlying causes. It's realizing that Tula needs to get more exercise. She needs to have more mental stimulation, then she'll stop licking her front leg. Or the cats with urinary tract disease, getting a pheromone such as feel away, giving them a private litter box. Number 4, ignoring holistic practices. Why would you ever use acupuncture or acupressure? There's no scientific studies to back it. This colloidal silver for infections is going to turn your dog blue. I suspect you watching this channel, you're open to holistic care, but not all vets are. I do get it, there's just so much to know now, information's growing exponentially. There are veterinary colleges making it really difficult for veterinarians to practice holistic care. But if you as the client are open to holistic care, you need to have a veterinarian that is willing to work with you. And as you know from this channel, there's just so many natural practices that are showing to be really, really helpful. Such as an anxious dog, why not a little acupressure? You're just putting your finger in between your dog's eyes, called the yin tang point. Hold that for 30 to 60 seconds. Quercetin, awesome natural antihistamine, great for allergies. 95% curcumin, great natural anti-inflammatory, awesome alternative to the NSAIDs. Licorice root, an awesome steroid alternative, great way to rapidly stop your dog from itching. Colloidal silver, it's a wonderful natural antibacterial. And that's just to name a few. Point in all this, you need a veterinarian that's willing to work with you and is open to holistic veterinary care. Number 5, failing to educate and empower pet parents like yourself. You need a veterinarian who's willing to explain to you, all the treatment options. Explain in detail the diagnostic tests, exactly why they're doing them, how that's going to help them, and or if they're even needed. Preventive care, what you can do to keep your dog or cat healthy, such as not feeding food like this. If you tell them that you're feeding this stuff, raw dog food, that they don't lose it on you. They're willing to hear what you have to say, your reasons why you're choosing to feed raw, maybe even be open to it. Me educating, that means empowering. It means having you play an active role in your dog or cat's health care. Tool is sick, she's a little bit dehydrated. Of course I'd be okay giving my dog sub-Q fluids. Ultimately, no question, you know your dog, your cat so much better than anyone else. And the way that your dog or cat is going to get the best care if you're actively involved. Thanks so much for watching this edition of Veterinary Secrets of why you should be questioning your vet. Click up there to subscribe, hit the bell to sign up for notifications, and when you click that link directly in the box below, I can send you a copy of my free book.